First of all, my name's Ollie Coburn. I'm part of the leadership team at BASRaT, and I just want to say a big thank you to everybody that's supported this webinar over the past few days. We've had a phenomenal amount of people try and sign up, way more than we ever thought would. So big thank you for that. Tonight we've got Mike James with us. Mike is a graduate sport rehabilitator. That's where his academic journey started, at least. Before that, he was a PTI in the British military. He's gone on to study a physiotherapy degree, masters in sports science, and he's got his strength and conditioning quals as well. So a very experienced clinician, wide range skill set, good academic history. He also happens to be a very talented endurance athlete. So Ironmans, ultramarathons, including what should have been the MDS this year. So big reputation, big shoes to have on the webinar, which is always great. He's been very generous with his time over the past few days in particular, which we're very grateful for. So please be kind to him in the questions. A little bit of housekeeping. We're going to be posting some chat messages in, but we have turned chat off just because it had the potential to get a little bit overwhelming with so many people in. Q&A, however, is still open. So if we don't answer any of your questions in advance, please get them posted. We'll do our best to answer as many as we can, either as we go along or at the end. So that's the intros. That's the housekeeping done. Mike, it's a pleasure. I suppose we better dive in. We better cover the important stuff first of all, and just really quickly touch on it. From a data protection, insurance, clinical notes perspective, we're not going to touch on that stuff too much tonight. We are going to do another webinar in the future covering that. But I think it's probably important, and I'm sure you'd agree, that you need to be on top of those things. So if virtual consultations is something that you're going to transition into, it's important to make sure you're appropriately indemnified for that. From a clinical notes perspective, it doesn't work any differently to your notes as you would normally do them. Everything should be documented, including your clinical reasoning, the history of all the tests that you've done or tried to do, the conversation that you've had, etc. Data protection is probably the biggest change, so you need to make sure people are aware they're being recorded and that you may save images or audio from that consultation if that's what you're choosing to do. And obviously the surroundings and the environment as well from a data protection perspective. You may want somebody to be in a quiet environment, no other people around them that could hear or interfere with the conversation. So that's some of those things. Please, if you want to chat in more depth about any of that stuff, come and join us on the next webinar. But let's get into the meat and bones of it all. Virtual consults, Mike, have been thrust upon us extremely quickly with the recent circumstances. But there are positives in this. So let's have a little chat about the benefits. So to the clinician, to the patient, what are your thoughts? How do you always approach it?
Yeah, thanks, Ollie. So I think I love the word that you use, opportunity, because generally across all the therapists, we've got a bit of panic going on. People feel like this is a desperation move they're forced into to try to be able to salvage some sort of business out of it. When in essence, this isn't a new thing. It's been around a long time. There are companies that exclusively work in telehealth or online work. And then there are others like myself who've been doing it to some degree for a number of years. So the benefits to the therapist straight off the bat is the reach that you now have. You are not limited by geography. You're not limited by postcodes and the availability you have for people to come into your clinic. You are now access all areas to anyone, anywhere in the world. It also means that you can work from home, which obviously we're forced to do. You're able to dictate your day and your working day in some degree beyond the scope of the usual type of clinic hours because of the flexibility of this type of system. From the client's point of view, from the patient's point of view, then they're sort of reciprocated. You now have open access to therapists. You have access to therapists that you may not have thought of seeing before. You have access to your existing therapist despite the doors being closed, so to speak. But you also have, if you're someone who, and we all know as sports rehabilitators, we all know of those athletes who never really address the aches, niggles, pains that they have. And all of a sudden now someone's pressed pause on every match, every season, every event, every race, which all of us to some degree have been hurt by.
Yeah.
But that has presented an opportunity for people to address problems and niggles that they never thought they would or wouldn't have considered a priority before.
Yeah, absolutely.
So suddenly there's an opportunity for those. I think on a bigger picture, if we were on our soapboxes preaching a little bit, then I genuinely think from a therapist point of view, we have the opportunity for the first large-scale opportunity to show just how easy self-management, reassurance, education, exercise prescription can be if applied properly to managing musculoskeletal and sporting problems.
Yeah, I'm really glad you mentioned that, because I think one of the big points that I came out with straight away when everything was rapidly transitioning into virtual was some of the most powerful tools in your toolbox are advice, reassurance, education, exercise, and they're all things that you don't necessarily need to be in a room with someone to advise on. So, you know, the really powerful, meaningful things that we do, you know, can still occur. And like you said, with the added benefit of additional reach, which is really cool.
I remember we're in the 90s here, but I was doing my sports science degree, and we did a module on disability sport. And one of the things we did was we all became impaired in some capacity for a day to live the life through the eyes of that sort of disability. Now, that was eye-opening. And if you imagine now, if someone had come into your clinic, you know, coronavirus wasn't going on, and someone was trying to sell the benefits of online consultation to you. And what they did one day was they walked into your clinic and they just tied your arms to your body and just said, you're going to have a full clinic list today. You're going to have to do everything you normally do, but you cannot touch anyone. All of a sudden, we would have a heightened sense of ability and confidence, hopefully, in our communications, our cueing, our coaching. And as sports rehabilitators, we may be able to argue that we have an advantage over the majority of other professionals, the other therapy professionals, because we are used to coaching, communicating, having people and groups in front of us, teams in front of us, and being able to use our voices and our explanations to facilitate people in a much better way than some others are. And this is an extension of that. It's just allowing us to develop or sharpen some of those fundamental skills that we should be using anyway.
Yeah, absolutely. And I think probably one of the other things that follows on nicely from that, we've had this rapid transition, probably referring specifically now to those that might work in private sector settings, so MSK clinics. There's obviously a big shift away from how a client journey might start, if you like, if that's the appropriate term. And I think what a lot of people have been getting flustered around is, what is the step-by-step? What's the process? And we talked, I know, about how important it is to have a plan and a step-by-step for that. Could you give us a bit of insight, maybe as someone who's experienced in doing it, into what your step-by-step might look like and some of the things you always have in there?
Yeah, absolutely. So the first thing to do before you do anything at all is work out who your customer target is. And for most of us right now, it's probably a time to really concentrate initially on those clients we already have on our books before potentially trying to find new ones. So the first thing most people should do is probably reach out and contact their existing client lists, their existing patient populations. Some of these people would have already been in the treatment system. So they may have sessions that have been cancelled. They may have sessions that they would do to plan to book in the coming weeks and months. So reach out to these guys, let them know that you're still around, you're still functioning, you're still an operating business and a therapist who is fully capable of now still treating and helping. And you all have your own systems, whether it's via phone or email or any sort of automated communication systems. But use what you've got and reach out to these people and let them know. I think that would be the first thing to do before jumping the gun. And often with these things, for myself, what I would do, and we've all got cross sections of patient populations. We've got different ages, different generations of people who are savvy or less savvy with tech. So how you approach some of these people. For a young IT literate person to suddenly go, that's cool, Ollie, I'll book in with you here. I know how you work. I know how this works. Not a problem. But if you've got a 60, 70-year-old grandmother and they are not fantastic with technology, then how you would approach those people may be different. So my advice would always be have a range of approaches for those people. So how I would approach my existing clients is I would reach out to them, let them know I'm still now functioning, I'm still around, I'm still able to help. And these are the options I have. I could contact you via old-fashioned telephone call. If there's any existing systems that you use, like a Skype or a FaceTime to speak to family and friends, then we can utilize those. Or I use other platforms, which are my preferred choice. And if you'd like to, I can help you with these. I think it's nice initially maybe to, depending on the size of your client lists, whether you do it personally or via that automated response. From there, you sort of have a template that you follow depending on the response. So it may be that some people need a taster session. You know, okay, it's something I'm interested in, but I'm not quite sure of the value. The number one question that therapists always throw is, well, how can I see someone without getting my hands on them? And then likewise, the number one question the patients throw back is, well, how can you help me without getting your hands on me? So some people just need that little 5-minute free phone call, free Zoom or whatever platform you're using, little session just to say, hi, hello, this is what we get you to do. This is an example of some of the stuff. At Sports Injury Fix, we recorded a fictitious example session. Now that's quite long, it's 30 minutes and that's not necessarily what everyone needs to do, but just a quick 5 minutes back and forth to show them how it's going to evolve is quite a helpful thing. Then if you use online booking platforms, online booking services, then updating those processes. I think what I'm finding is a lot of therapists are learning the technicalities of using these systems and then forgetting the fundamental changes that need to go alongside it with their business. So setting up any automated templates, any emails and any notifications and stipulating what needs to go on there. The things like the links to the GDPR compliances, the privacy policies, simple things that we would do normally. So if you think of, when we all drive a car, most of us drive cars, we often jump on holidays or go away on training camps or whatever, and we drive in a different country. And all of a sudden, there's little things we need to tweak, but the fundamental skills are the same. And this is no different. So what would you need to have in place if you were physically opening a clinic or a second clinic or expanding your practice? You'd have to have some new administrative paperwork. You'd have to have some new booking system changes. You'd have to have some little things that are tweaked, and this is just the same. If you then decided to branch into recruiting new clients, then potentially how you would advertise it and how would you market it would slightly need to change to help them into the client journey. And that would often be along the lines, my advice would be to just reinforce the fact that you can still help people despite the fact that you're doing it remotely.
Yeah, definitely. And I really like that comparison as well. You know, I've not heard you use that one yet when we've had these discussions, and it's true. It's a really nice way of framing it. In terms of getting into the meat and bones of it, because this really answers the question of how can I help. We'll probably try and approach this a little bit structured. I know we said we were going to try and do that. We'll probably go off track at some point, but from a subjective perspective, I think one of the things for me that's of heightened importance, it's obviously, you know, very important anyway, is red flag screening. So just let's hammer home some of the key points around you know, screening somebody, having those conversations in your subjective, first of all, and then we can chat about any similarities or differences thereafter.
Yeah, absolutely. And I think it's important to note that red flag screening could be pre the appointment. You may send some paperwork, you may send some sort of health questionnaires, some screening questionnaires, or someone might contact you. Yeah, someone might phone you to say, I'm interested in booking in, can I book in? And during that conversation, you can just be on your vigilance for that type of stuff. And therefore, you know, when there is a suspicion of something that you deem a concern of significant concern that you need to forward on, then absolutely this is not an appropriate forum to be seeing people and be doing things with. So, but the subjective, including that red flag screening, is probably the bit that changes the least.
Yeah.
This is the thing where we communicate and we glean so much information from the subjective. What I would say is you should probably be more confident now, because what you have done, and we'll come on to it in the objective, is we've naturally removed a pressure, a expectancy, and a time constraint that we would normally put into an objective assessment to spend longer focusing on the subjective. We've probably all sat in clinic with that runner who comes in, who's itching, and they're making little sly looks at your couch or your multi-gym or whatever you've got there, because they want to get to that bit. And now you've got them focused, so you can really double down on that stuff. So from the red flag stuff, I know we chatted, there was going to be a link we were going to share to do with the Nhs Guidelines.
Yeah, I've just put that in the chat actually. So
yeah,
that's a really helpful resource. I mean, feel free to use it internationally, but particularly those guys that are in the UK, there's just some up-to-date information literally from a couple of days ago that's been put out by the NHS about screening for these red flag urgent conditions that would require acute care. So check that. I think for me,
and although there's a couple of unique things in there to do with COVID-19 patients, etc. But fundamentally, there should be no catches or tricks in that document than people should be doing on a daily basis anyway. It's basic red flag screening.
I think one of the big changes for me that might be a little bit different doing something across a screen rather than face-to-face is that I think some of the red flag questions can sometimes seem a little bit invasive or a little bit insensitive. And I think that's an easier barrier to overcome when you're sat in a room with somebody, because, you know, you can use body language to communicate and, you know, it will come across differently than through a screen. And I think expectations setting is really important with that, isn't it?
It is. But again, the communication starts prior to the assessment. So that pre-assessment paperwork or email, whatever correspondence you have with them, we'll have a chat. We'll be asking certain questions. I'll explain why we're going to be chatting about those questions. And the thing I noticed from the therapists that I've spoken to who've recently taken up the online stuff, the point I seem to be hammering home more about the subjective than anything else is don't rush into it. If someone comes into your clinic, into your practice normally, then there's that chit chat. There's that little 5-minute, how are you? How have you been since last week? How was the holiday you went on? How did your daughter's dance class go? The usual things that we talk about. Because I think you're staring at the screen and someone's just staring back at you, and there's this, I'm feeling a bit pressured because I'm not familiar with this, and they are probably pressured because this is a bit weird. Then suddenly we try to convince them and jump into it to say, this is the right stuff, this is what we should be doing. Yeah. But build that rapport, build that therapeutic alliance. If it's an existing client, then by all means, you know, well, that was a bit more of a faff than I thought it would be, you know, sorry, it's mucking around. You can, luckily I'm better at therapy than I am at tech, and you can really mellow that conversation out. And then it should, again, lead to the ease or a greater ease in asking those relevant questions.
Yeah, absolutely. And then our other red flags, obviously, we can still do the visual aspect. So, you know, if we're looking for things like, you know, signs of infection, severe deformities, things like that, it's a case of a little bit of preempting what might happen, you know, camera setup, make sure you've got space in your room, making them aware they might have to be able to show you the affected area, and that might involve removing clothing or whatever. But we can definitely still do that. So, you know, painful wrist, painful hand, really easy to show you. But in essence, we could screen quite easily, visually still, for most of the other physical red flags.
Yeah, and any of those physical tests, including the objective later, then it's really imperative that we're forceful and polite enough, but not shy to really explain things if they're not following it. Don't feel that, you know, he's not quite getting where I want him to be there, or I can't quite get that into picture. And therefore, that natural tendency to go, okay, I've tried to explain it a couple of times. He hasn't quite, or he or she hasn't quite got it. Let's skip on. That's those danger zones where we can miss things. Whereas, Clive, I'm showing my age now, I'm using Clive as an example. Clive, that camera's not...
Clive
that's not quite where I need it to be. Sorry if I'm not explaining myself well enough, but can you just move your camera a little bit? Can you just tilt it a little bit or lift your arm up slightly higher? I really want to get the best view of that I can.
Yeah.
Oh, that's great. Thanks very much. So it's a quite good, laptops and computers are fantastic, but if you've got someone that you think either the body part they've got a problem with or the assessment movement screen type thing you're going to ask them to do warrants more mobility and flexibility, then using mobile phones or mobile devices is a much easier way to do it. Right, can you just pop that on the floor, take a couple of steps back, turn to face me, perfect. So be forceful enough to really get them to follow those instructions. And again, I have slightly more confidence talking to a group of sports rehabilitators to do that than maybe some of the other professional therapists that we work with, because they have a certain personality type generally that are more comfortable having that instructional teaching type element to their game.
Yeah. I'm gonna jump in with one question because someone's posted it, which is a really great question. So Michelle, thank you. So she's asking about patient consent, which is something that we didn't really touch on the practicalities of earlier. And there are a number of ways of doing it. Personally, I use an online form through Google Docs, Google Forms, and get people to sign up through there. That has an explanation on it of everything that's going to happen and the data protection implications and everything else. How do you do it, Mike? And what are some of your other thoughts?
So that would be my gold standard. I think that's what everyone should strive to get to. If you, from a business point of view or just wanting to help your clients' point of view, want to get started and then evolve those sort of practices later on, then there's a couple of options that you can think about. There are many people, regulated bodies, who will accept the fact that because someone has accepted your invitation and then activated the call, then they've given consent. Most of these, as we're doing with this, they have a recording facility. So make sure to gain consent verbally to record or in a documented form if you're using that. And then when record...
So like, for example, we're recording now, this audio can be saved separately. So it would literally be a case of, Mike, we need to go through your subjective assessment and I need to look at your shoulder. Would it be okay if you remove your t-shirt for me so that we can assess that? Is that okay?
Yeah. And again, and we all trust our practices that, we operate with the theory being, would I stand up in a court of law if the worst case ever happened? Now, I would much rather go into a court of law with an audio or video recording of someone giving me consent, followed by everything that I said and did with these people, than sometimes my documented notes, because this seems a much stronger argument. So consent can be gleaned a couple of ways. Verbally would be more than adequate for most of us, but if you can kick on to get some documented consent and maybe the verbally recorded stuff, then even better. You're just watertight.
On the recording, just to smash out another one of the questions, recording's fine, but there's two things with it. Make sure the patient knows you're recording. That's extremely important. Make sure they've consented to you recording it. And then make sure you're saving it and storing it appropriately. So, encrypted, if it's going on a cloud somewhere, fully password protected, or saved on a kind of hard drive or solid disk that can be locked away somewhere and that is safe and secure. So save it with whatever your local data protection legislation tells you to do. Recording's fine as long as you've got the consent. And obviously if the patient's not happy with it being recorded, get the written consent, don't record it. I think most platforms like this and other kind of specific video consult softwares will all have an option to not record or record.
Yeah.
Cool. Right. That was a little bit of a sidetrack, but the questions were good, and it brought us back to a good point. So yeah, I think we've probably touched on all the key points with subjective. We obviously don't need to do too much hand holding in telling people what needs to be in the subjective. It's actually no different to what you do in person. It's exactly the same, and in whatever clinical format you would normally follow. I'd probably urge people not to really change that process from what they normally do, because you'll then get flustered and have more tendency to miss stuff. So keep it the same, don't change it, and do anything.
The general feedback I get of people, and it's exactly my experience as well, is it's actually better this way, because there's less distractions. You're just listening to someone, cross your arms, sit back, let them do their 2 minutes of talking, like we're all supposed to be doing, and let them speak. The only thing I communicate sometimes is, even if I'm recording, sometimes I have a little notepad, or I might have their existing notes if they're a client that I've seen before.
Yeah.
So I do express to them, look, if I'm looking down and I'm making some notes, then please, I'm not being rude. I'm just making some documented notes for your folder or your file. But the subjective bit, most people find more benefit from than less benefit.
Yeah, absolutely. I'm getting a couple of questions just about what are rules and regs for other countries. Don't know, guys. Can't advise you. But definitely check and reach out with your local governing bodies for sure.
And if you, and again, depending on the country, then be very careful. I've spoken to therapists in the past who are US based, and because everything is legislation is run at state level, then even if they were to do telehealth stuff with someone cross-state, interstate, occasionally there's slight rules and regs and T&Cs that are different between states. So check with your regulating bodies, your insurers, and they'll give you the answers that you need.
Yeah, for sure. Right, let's dive into objective then, because this is where things get a little bit more tasty. So I don't know where you normally start with an objective. We've covered observations already as part of our subjective and red flag screening. So I guess from there you might go to range of motion active tests. So what are your top tips, golden rules? How are you going to conduct this?
Yeah, so this is the chance to be inventive and innovative. There's so much more that you can do than you think. There are obvious things that become almost impossible. As we've mentioned, hands-on stuff, certain neuro testing, certain sort of palpation tests are just, However, you can be quite inventive with them. So it would depend on the client in front of me where I start, but certainly range of movement tests. They could do active stuff themselves. They could do some basic strength testing. You could apply some resistance of whatever they've got at home to enhance some of that resisted testing.
Yeah.
Functional testing is absolutely fine as long as they've got the space. You just may need to be a little bit more selective in the tests you do. You can even get them to do some neuro tests themselves. If you wanted things like touch and feel, or sort of dermatomal stuff, then you could guide them and screen them through the process of how to do it, and then just get their feedback from it. I've certainly had people doing slump tests, modified slump tests on themselves, for example. You just talk them through it. Now, I know I've been communicated with Tom Goom about it. Tom is really good at sending them videos, PDFs, things in advance of these are some of the objective tests that I'm going to get you to do that may be a little bit more complicated. So rather than us sucking up so much time in the session, here's a little bit of advance notice and you can learn them and try them and we can go there. I've had people do a modified Thessaly's test on themselves using the equipment they've got around them. You can easily, it's not perfect. There's
probably important to say, I don't even think you need the equipment. I mean, I've had someone doing rehab before that had no equipment, but used a bucket with some water in it. And if they wanted it heavier, they'd put more water in. And if they wanted it lighter, they'd pour some out. So it really can be as simple as that, but it comes down to being a bit creative with it.
Yeah. I think it's important to not do too much in the objective. And then, because you'll find a way to make it awkward and difficult if you want to. However, if we've spent longer and we've been a bit more thorough in that subjective, then in essence, we should have less to worry about in the objective anyway.
Yeah.
But certainly movement assessments, endurance tests and things like that, there's no reason you can't get enough to solidly confirm a working hypothesis and a couple of differential diagnoses and then be able to move forward from there. Just think of it as a simplification of what you would already do. And you can, as you said, special tests aren't that special. You can get someone to do some modified one if you wanted to themselves, but are they really going to make a difference in what your rehab or your working plan will be? Probably not. No. So again, there's that.
And you're going to come back and reevaluate that anyway. You're going to, as you would in person, you would implement some intervention. You would then retest acutely, so within session. Okay, we maybe can't do that, but what we certainly could do is follow up after 24, 48 hours. And then the rehab that we've applied becomes additional feedback and adds to our working diagnosis.
Yeah. So there's more that you can do than you can't. One of my top advice is, if there's guys watching and you work in a practice together, but now you're all based at home, or you've got friends, colleagues, peers that you know and trust, then as a process of practicing this stuff, then do a little call to each other, make sure you're comfortable with the tech, and then do some mock sessions, play around with some stuff, see if you can invent modifications to certain things, see which things work, don't work, and just play around with them. It's not going to cost you anything than a bit of time and effort. And then you'll work some of those things. Most of us now have professional careers that focus within certain remits. Myself working in the endurance world, then I've got half a dozen to 10 tests that I need to really get through with most people. And that covers the majority of the things I see. Yeah. If someone suddenly tomorrow got in touch saying I've got problem X and I used to see problem Y and Z, then I might have to think on my feet a little bit more. But most of us think of the type of people that you see, the type of clients that you normally see, and the things you normally do, and what can work and what can't work from those things in an objective assessment that I can make work in this. What coaching cues do I need? What space and cueing, coaching type things do I need to get it to work?
I think one of the other really good tips I got given as well, and I can't take the credit personally, but a lot of these tech platforms, if you play around with them, you've got screen share functions. So someone said to me, well, how about go on YouTube, pull up a video of the objective test that you want somebody to do and show them that video through the screen share, and then say, right, can you go and try that for me? And that covers all your bases then, because some of us are better at communicating than others, and we might find it easier to describe the test verbally. And same from a patient understanding as well. They may not understand it verbally, but as soon as they see it visually, it makes perfect sense. So using multiple methods of communicating it as well.
Yeah, and certainly on Zoom, there's a little fancy thing called a virtual background. Yeah. So I've seen there's a lot of personal trainers that I'm working with, and they put the whole sort of overview of their program behind them, so that when they're talking, the athletes are looking at the program and the exercises, and they're just pointing to different things. It's just playing around with stuff and seeing what works for you.
Yeah. And when it comes to rehab, I mean, what we can't do is just be with somebody in a gym or in the clinic or whatever setting we're working in. We can't kind of physically tweak movements. If we're trying to get them to do a squat in a particular way and we want them to move a joint position or something like that, we can't do that anymore. So cueing becomes really important, doesn't it?
Yeah, absolutely. And I say I think it's where a lot of therapists are now scrambling. It's where they're really having to upskill themselves to really think about those things, because perhaps they don't. But sports rehabilitators are from a background in exactly this stuff. So this should be the stuff that we just know. I can help you with movement cues and coaching cues, keeping it simple, couple of instructions, and then however you want to follow that up on sort of summary at the end of the session is different then.
Yeah, it's where some strength and conditioning knowledge really comes in handy, and having a bit of experience of actually coaching from a performance perspective, not just from a rehab perspective, because you tend to find that when it's performance, there's more emphasis on cueing things and making smaller changes and being able to verbalize that. And I'd probably say for the people out there that aren't as familiar with doing that stuff, practice it, and because that's the only way to get good.
Yeah, definitely. And again, keep it simple. there's so many ways to progress an exercise and coach that exercise without bringing out MSCs and PhDs to try and overcomplicate stuff. You know, just keep it simple, give them less. Less is more, definitely in this case. And you'll find you'll get comfortable at starting to give less pretty quickly.
Yeah, definitely. And focus in key exercises, which are the most bang for my buck, you know. I know it's the other things there's multiple tools out there that we can use to prescribe exercise. Penny, for your thoughts on those? Do you use any? The kind of apps and the exercise prescription stuff?
Yeah. So I personally don't. Because of my background. My background is I like to be very specific and bespoke with the people in front of me. Obviously, they do follow themes based on the population that I tend to see. But I tend to do it one of two ways. My preference is normally so I saw a guy yesterday, I did a consult yesterday with a guy with some insertional bicep problem. So I explained what I needed him to do, and he went through it on the session. And then I literally jumped off the call, set up my mobile phone and spent a minute recording the exercises with a couple of key points myself, and then pinged the video across to him. It was an extra minute within my admin time for that session, but it gave him a real specific, and I was sort of, I addressed the video by name, told him the exercises by name, and just gave him those to work off. Yeah. And that could be fundamentally different to the next person and the next person and the next person. I don't have any problems with people sending pictures and images or YouTube links, and likewise there's some fantastic exercise prescription software out there. I've got and a
lot as well where you can add your own videos into that. So in your scenario, if you feel that somebody may benefit from being able to track their progress and feed that back through an app, and have something that will actually kind of give them a nudge to complete stuff, then absolutely nothing wrong with loading folk stuff to those.
But it's important to have a range of options. Like at the start when I said there's plenty of platforms you can do this on. So the first question for me when someone wants to book or inquires about an online is, what format would you feel comfortable with? And they might already say, Zoom's fantastic for me, I use it in work. Or can we do it on FaceTime? Whatever. And although I prefer them to do it on one than the other, I'll bend to whatever they need. It's me that needs to be more flexible than them. So likewise, come into the exercise prescription side, that's normally the question I say. There's a range of ways that I can deliver these exercises to you. What would you feel most comfortable with? They may have, you may have someone with a learning disability who needs it a certain way compared to something else. Yeah. Maybe someone who just goes, a video works well for me, but I don't need you to spend time going off and filming something. If you've got something you can send me a YouTube link to, perfect. Yeah.
I've even had some times who can't use an app.
Yeah, exactly.
It's the perfect example, isn't it?
Yeah. So there's been times in the past where, and it's a lag, is a delay with it, but you might literally get the old Matchstick Men drawings out and post it old school to someone, snail mail. Yeah. It's whatever works for them. If you're trying to ask them, they've already had to bend. They've already had to find a way of working with you, which may or may not be their preferred choice. So the less change you can give them, the better. But it's whatever works for you and what helps them the best.
Yeah, 100%. And so we're not just exercise buffs. We do throw some manual therapy in there, some hands-on, when we can actually get in a room with people. And we're not in the midst of a global pandemic. So I've had so many conversations, I've lost count, with practitioners who say, well, a lot of my work is manual therapy based, and I'm finding it really hard and a real challenge to transition to virtual. But I know you've got some really good thoughts and ideas around instructing people to do their own therapy and things that we can do there. Yep. So I'm not going to intervene. I'm just going to sit back and listen, because this is going to be as helpful for me as it is for everybody else.
Yeah, so I think, again, it's not trying to overcomplicate things. So, for example, if you are a manual therapist or some sort of massage therapist, soft tissue person, then normally at the end of your treatment session in clinic, you generally say, here's a couple of self-help things you could do at home until I see you next. Could be some trigger point balls, could be some foam rolling, it could be some soft tissue work, or any of those tools and applications. So why not just become that conduit now to pass on the knowledge of how to do those things. So you may well, if you're someone who has a client base who need that interaction, you could just do a 30-minute session where you're doing it with them or talking them through it, and it becomes like a one-on-one coaching session, or a series of videos that you could link in, similar to the exercise stuff. We've certainly done one with some massage therapists lately, where we recorded a way of showing them self-help massage techniques.
Yeah.
So there's a range of ways, whether you demo stuff, instruct things, or walk them through it. And again, it might just, we hopefully have a finite length of time that this is going to be affecting us all. We don't really know what that is, but fingers crossed. But it's short to medium term, hopefully. So if it is a case of someone that you already have in your system that you do lots of manual stuff with, look, this is going to bridge the gap to get us back to the time that we can be back in clinic together and get my hands on you. Let's go this way. It's better than nothing. If it's a new person, it might be, here's some things to get the ball rolling. Hopefully it makes such a difference you never need to come and see me. But potentially you will when the cloud is lifted. But there are options. It's the one category of therapists that I seem to have had the biggest change in thinking with, that this is now a possibility. There is definitely things you can do. Sports Injury Fix, again, we recorded a mock instructional video with this one, the two of us just pretending someone had some soft tissue injuries, and we gave them some stuff via a link for them to go and play around with, and that's all available for people to check out. So, but again, be inventive with it. So how could I instruct this? It doesn't matter if you've never had to do it before. Have a play with it. If I wanted to teach someone how to do this, how would I do it? And you'll make mistakes. You'll have 1,000 outtakes for memories to laugh at in the future.
Yeah.
But film yourself, try it all out, see how you get on. You might find that what you're doing is perfect and the camera angle is perfect, but you just sort of spout in a little bit of nonsense in your description, in your narrative, and you refine that a little bit. But there's definitely ways to continue. It's I guess, if we're trying to find a buzzword, you can be hands-on whilst being hands-off during this period if you get inventive.
And you can also, if somebody's in circumstances where it'll work, draft in a bit of help. There's no harm in saying, right, okay, grab your partner, grab a friend, family member, whatever it is, and we'll teach them how to do a very simple soft tissue technique, or there's a particular stretch that you might need some assistance with. So, here's how they can help you do it. And again, it comes down to that thing of camera setup and being able to mess about with the mobile phone and whatnot. But definitely also an option, isn't it?
Yeah, absolutely. Nothing is off the table here. There are things that become very, very difficult to do, but you're limited by your imagination in this stuff. The online spectrum, you are limited by your imagination. Yeah,
definitely. Cool. So I know that covers a lot of the clinical stuff, and it's probably an important point to just, or important time to just jump in and say that for everyone that's registered for the webinar through Zoom, we're going to send you out the resources that Sports Injury Fix have put together. Massive shout out to the whole team at SIF, because over the last few weeks they've been like hamsters on a wheel producing this content and bringing it all together, and it's so helpful, and it's all in one place. So there's access to the videos that are together, the blog posts, all of which Mike's contributed to. So everyone that's registered is going to get a link for those. We'll send those out. Please check them out. That will probably reinforce and cover a lot of what we've talked about, and probably a little bit more as well. So yeah, 100% go and look at those, and get in touch. I know Mike's already mega busy, but I'm sure he's going to be happy to help with the rest of the team at SIF as well. So use them, and that probably gets us to the end of our clinical chat stuff, other than to say, please reach out if you do have more questions, and we'll try and cover little bits in the Q&A at the end. One of the other big things we talked about, and I know you put a video out about the Joe Wicks effect, was how can we adapt. Again, this is probably aimed at the business owners, the private practice crowd. How can we adapt our the ways in which we attract new patients to our clinic in these times, and how can we use our knowledge and our skills to improve the health of our communities as well, because that's another really important part of our role, public health part of our role, to encourage people to be active, and etc. So yeah, fire, because you're the man for this kind of stuff.
Yeah, and I think like social media in the last 10 days has literally become the Wild West. There's the rule book has been torn up, and people are doing all sorts of weird and wonderful things. And what I'm starting to see the trend in is people starting to lose their base identity. They're trying to think they need to change and adapt when they've all got a unique skill set and a unique avenue they can go down. And you mentioned the Joe Wicks paradox that I was talking about. Is there's people who are getting annoyed, getting frustrated that people are offering this simple baseline advice. But likewise, not everybody needs that. Some people need more complex stuff. From the public health stuff, I think there's a few things that I've thought about personally with this stuff. Number one, there is a lot of sportsmen, athletes, runners are massive for this, where there has been so much of their livelihood taken away from them. So they can't meet for their club sessions, they can't meet for their training runs, they can't meet for their training sessions as clubs. And now they're all sitting around at a time slot where things would be occupied that now isn't. So something I started to do, which was to cover a few bases, was I started reaching out to all the local running clubs, triathlon clubs near me, and offering a free Facebook Live. All they need to do is let you into the group and set up a Facebook Live, and you're good to go. And I did it during times when these clubs were due to be on a training session. And it was just a free-for-all Q&A. Some sent pre-questions in advance, and some just threw them out while I was there. And I spent an hour of my time with everything from, depending on the size of the club, anywhere from 20 to 200 people in these forums. And it was free advice of what they can do to train right now, some injury advice, what they can do to keep strong, things to think about with their running or their training. And at the end of it, of course, there was a little soft lean to, by the way, I'm doing online consultations. If there's something you want to chat about more, if there's something you want to spend more time talking about, you can book in to see me. Now, some people will have just thought, oh, that was quite helpful, free advice, and will just maybe tip their hat to me in the street in months, years to come. Some people might take me up for the online booking, and some people maybe 6 months, year from now, when they pick up that injury, will go, oh, I remember that guy who did the Facebook Live. I might be able to go and see him in his clinic or whatever. So that's an option. I think you may expand your remit. Perhaps you will offer class sessions online. Perhaps you will offer something that is outside your normal wheelhouse, and that becomes a string to your bow.
Still within scope. Someone's
still within scope, but outside your comfort zone.
Big caps lock statement. Yeah. And Francine, 100% agree with you there.
And again, for some people, some of these avenues to either recruit people in the short term or long term may be a string to the bow they never thought of using, and it's only in the short term. I will lose my facility. I will not be able to pay my staff or myself if I don't do these things. But it's so far out of my comfort zone that as soon as things go back to normal, that's just a memory. And others might find that, you know what, these are avenues to help people generate income and think about stuff that is something I really want to move forward for. The other avenues to think about things are twofold. I think we've all got stuff that we want to do in our business lives that we never get round to do, whether it's painting your clinic, whether it's upgrading your admin process, spring cleaning your business from top to bottom. Yeah. Now, we unfortunately probably have a bit of time to do that. And then finally, I think, unfortunately, we are going to be left with a situation where a lot of people will survive and recover from coronavirus and will need a lot of rehab and recovery, and we're perfectly suited to help these people. Yeah. So sitting down and planning how you could do that in months and weeks to come is probably something that will be a good thing to do for the public, but also for your business when we're all trying to get back on our feet, probably an avenue we should look at. Yeah.
And probably one of the other things I want to touch on, and I'll float my own boat just a little bit, because I actually made it onto international radio the other day with this. So please be an advocate for people's health as well, in a general sense, within your own community and your own network of friends and family and things like that. Be that person that people can reach out to. if they're unsure, uncertain, lots of people are struggling with the mental health. Obviously, it's not necessarily within scope to help them directly with their mental health. You can be a person to talk to and try and come up with ideas and initiatives to keep people active, keep people moving, because it will massively help them with these things. And, you know, because the current situation that we're in is affecting everybody. So, little practical example, I set up for my running club a virtual club runs group on Facebook. So what we do, we would normally have a session every Monday, every Wednesday. We meet up 50, 60 of us, and there's a planned session. Okay, so we took that idea and instead we flipped it and made it fun. So the first one that we did was you're allowed to run a route, any route you want, between 5 and 10K, and you have to go past as many pubs as possible. And you're gonna screenshot your Strava, you're gonna post it in the comments, and we're all gonna have a laugh and see you won. And it's little things like that. And because this is the perfect time to do it. You've got a little bit more time on your hands, and you can be a really engaged, helpful member of your community. And that goes a long way. People will appreciate that. Something I definitely encourage.
Yeah, again, and the other thing, I think the community started doing it around here with me, but I've tapped into it as well. I've always advocated to professionals to network, whether it's other sports rehabilitators or other therapists or things like fitness professionals, dietitians, counsellors, psychiatrists, psychologists, to just have those bigger reach within the community. And like you said there, when it comes to things like mental health, well-being, then we can't go outside our scope of practice. We can just be nice, decent human beings and help out. But if there are people that you now suddenly have more time to reach out, start communicating with, trying to help them help other people and vice versa, then certainly, you know, there's a fourth-year medical student in my town who's kindly offered, she's been sent home obviously from uni, and kindly offered in the local Facebook group to walk people's dogs, shop for the vulnerable, and just basically just be a really decent person.
Yeah.
So the first thing I did was just send her a little message going, fantastic what you're offering. I'm an MSK therapist. I've got a bit of experience. If you ever wanted to chat while you're at home about how MSK links with medicine and my experiences of working in the NHS or whatever, then please feel free to pick up the phone. You're doing something decent for someone else. I'll do something decent for you.
Yeah.
She's not phoned, so she obviously doesn't rate me. But most of those things. Yeah, most of those things are just decent human being stuff. They're nothing more than that.
Yeah, and it definitely, to an extent, falls within scope. You know, we all have a responsibility to look after the health of the people around us, whether we're getting paid for it or not. Especially at a time like this, I think our skills and knowledge are so valuable that it's responsible to share them, I think, in a meaningful way.
Yeah, absolutely. Sure. Absolutely.
We're getting tons of questions. I'm trying to pick out a theme to see if I can kind of knock 4 or 5 out. So I've got a few around, probably linked together. So how long would you spend with someone on an online consult? Would you alter your prices and just typically ballpark fee? I know fee is going to waver where you are in the country and who you see and things like that. But some thoughts, and I can get rid of a few questions then.
Yeah, really good questions, really typical questions that we're getting asked lots lately. So fundamentally, it's up to you and your business and how you work to decide on what you're going to charge someone. Some people, and I have not got a problem with this, some people fall off the thinking of they're paying for my time, knowledge, and experience, and the years it's taken to gain that time, knowledge, and experience. Therefore, my fees won't change. And they justify that themselves that way. Some people, and I do this myself, they have a pro rata fee. So depending on the time. So my follow-up appointments are the same length, same time duration as my in-clinic ones, 30 minutes. But my new patients would normally be an hour. And now that's a 45-minute session, just because there is that element of reduced objective testing. So I then basically have prorated my fee for my 60-minute session down to a 45-minute session. What is really important with this stuff is, although you may need to reduce fees as an introductory offer, particularly for those people who are reluctant to take you up on it, then likewise at the same time, you really can't undervalue or undersell yourselves or your business. That's the key thing here. You are a professional and people are paying for your services.
Yeah. They're paying for the outcome. not necessarily the time that they spend with you is the way that I would always encourage people to think about it. And it's the same in a face-to-face setting. You know, it's people come to you with a problem. You know, they're in pain fundamentally, and they don't want to be in pain anymore. And your skills, knowledge, and advice will help resolve that situation for them. And it's that resolution that is what the fee is for, rather than how long it takes to get there and whatnot.
But again, be prepared to be flexible. You know, I live in a small little town just outside Cardiff, which is quite an affluent town. And there's probably a lot of people that live in the town I live that are completely unaffected financially by this current circumstances. Likewise, not far down the road from me is a town that's fundamentally crippled probably by what's going on. And if someone there reached out wanting to be flexible with fees compared to maybe someone locally to me, then I'd have to consider if I can help them in any shape or form. As long as I'm not underselling or undervaluing myself, then it may be something I should be flexible on.
Yeah, absolutely. Because it comes back to that thing, doesn't it? Of let's help people in their time of need. I've taken out loads of questions here. Sorry, I look like I'm not paying attention, but I really am. I'm just trying to read through them all. Thank you for all the lovely feedback as well, guys. And those of you on Facebook, I'm trying to keep my eye on some of the Facebook comments coming in on my phone. So hi to everyone that said hello there. Hi, Gary, if you're still watching. Okay, Q&A time. So let's see if we've got any more questions coming in. If you've got a burning question, now is the time to ask, because I am reading through them. What apps do people use? Personal preference, there are loads out there. I've used numerous stuff in the past. I know all our BASRaT crowd, due to recent events, will be very familiar with Rehab Guru. We're actually holding a webinar on Friday with those guys to discuss their platform specifically, and some of the other issues that me and Mike touched on earlier around insurance, data protection, etc. So for those of you in the UK who are watching, maybe worth tuning in for that one. But yeah, have a look around and see what works for you. For video calling, Zoom, a lot of these apps have stuff built in. I know there's WhatsApp, FaceTime, all the other stuff. Hopefully that covers off some of the app questions. Let's go to the recent comments. This is so helpful. Thanks, Jess. Very kind of you. Okay. Cool. Right, I think that's it for the questions, Mike. Anything you want to throw out there? Anything you want to add? I mean, I'm just going to chuck a quick poll up because I want to just get a feel for if anyone else would be interested in doing these again in the future. So you should have just seen a poll thing pop up if you want to answer that for us, guys. I'll leave that running for a minute. Anything you don't think we touched on, Mike? Any closing thoughts? Anything you want to chat about? Doesn't even have to be rehab related. We've still got kind of a minute left to get through some bits.
Yeah. No, I think from this stuff, the take-home message I'm always trying to give people with this is, at first this may be scary, it may be something that feels a little bit weird to people, but you should really embrace this, even if it's short or long-term, as I mentioned. I first started doing this about 5 years ago from my coaching lifestyle. I was seeing athletes from all over the world or people who were away on training camps. I did no therapy by it. I was just doing coaching, and that was probably a bit simpler. And then I started embracing it with the therapist stuff, and I made mistakes. It was tough. I got things wrong. Many times the appointment didn't happen because the link was broken or whatever. But as with anything in our profession or within life, a little bit of practice and you get better at it. You don't need to overcomplicate it. Keep it as simple as you need and your clients or patients need. And it may end up being something that's really useful for you. As far as with all the setup stuff from myself personally, or on any of my things as the endurance physio, or with Sports Injury Fix, then please reach out for any help you ever want. We offer free advice at Sports Injury Fix, and I will reply to anyone who messages me with any questions, anything someone might not want to ask in this sort of forum, or if there's any questions here that haven't been answered, then I'm more than happy to spend some time answering them. But
yeah, Mike and myself are both on Twitter. We can often be found sending each other stupid gifts. Are you at the Endurance PT? Is that right? At
the Endurance PT on Twitter and the Endurance Physio and everything else. And anyone who sends a question via a silly GIF will get an answer immediately. GIFs are the way forward.
GIFs are the way forward. That is how it's done. I think from my end, what I would just say, we are going to send these resources out, so everyone's going to get an email in due course. So anything that we've talked about tonight will be covered in the resources that we send you, and included in there will be contact details for Mike through SIF, and there'll be links to his social media and stuff like that as well, so you can track him down and ask him your questions. I am really sorry if we've not managed to answer them live, but I literally cannot keep up. We've still got 400 plus of you listening to our dulcet tones on a Wednesday evening, which is phenomenal. So thank you for your support. We're going to get signed out because I've not had my dinner yet, so I want to go and eat. We will end it there, but on behalf of everyone at BASRaT, Mike, and probably everybody watching as well, because some of these comments are great, just want to say a massive thank you for being so generous with your time, sharing your advice, your knowledge with us, because now more than ever, I think people really appreciate that. So thank you.
Thank you. Thanks for the invite. Stay safe, stay well, everyone. I think one of the massive benefits I'm seeing here is the therapy professional world is coming together like never before. We're all helping each other out. We're crossing down boundaries and breaking down barriers, and it's really heartwarming to see. Yeah, absolutely. I'm just going to check us out of Facebook, so we're done there now, bud. We will catch up, no doubt, at some stage. So I will see you on Twitter. For everybody that's tuned in, we're going to end this now, so you'll probably get cut off. Once again, thank you for watching from wherever in the world you did watch, and we will be in touch with you soon.